Hi, it's Dr. Nami, and today I want to talk to you about one of my patients. Her name is Sandra. She is lovely. Mid 60s, CEO, really busy, has a lot of work going on, and just kind of tired all the time and a little exhausted and a little drained and not really understanding why. Sure, there's things that happen with aging, but again, just want to be really proactive and really take care of ourselves. So she came to the office and I said, okay, let's get you started. So we started with her old microbiome, and then we also looked at her functional airway. So I'm going to show you what that looks like. And then with some really awesome results. So it's really great to share too. So here we go. Okay. I'm going to share with you, this is her case. This is her comparison results. So she started out with red light bacteria and then yellow light bacteria and green light bacteria. And you can see here that we have a 43 billion bacteria reduction, which is awesome to see. And earlier I kind of mentioned that you're always going to have a little bit of this red light bacteria if you have sleep apnea or you're breathing through the mouth or have something called upper airway resistance. And so in her case, I usually see, reduction about the 80s or whatnot, 70s to 80s. And I said, in your case, let's take a look around. So we actually ended up doing her CT scan. And here you can see how small her airway is. And then, of course, we tested her for apnea and TMJ, and it does turn out she has potential apnea. So we actually wanted to address both of the things. So not only do we wanted to get rid of the bacteria in her mouth, but we also wanted to make sure we started her on an optimization journey to help avoid heart attack, diabetes, and cancer. So this is some pictures. These are some pictures. This is her gum. This is what she started off with, the red puffy. Look at that. This is what she ended up with when it comes to that. And she just started her Vivos process. So she just was raving. She was telling the whole team her gum issues feel better. And now she's like feeling in charge, right? Even the airway expansion, she's seen so much improvement into such a short period of time. And the most important thing she says here is my overall health is improving. Now I'm going to repeat that. My overall health is improving, meaning that she is feeling better about herself. She's feeling better about not just like she's feeling better physically, emotionally, and mentally and spiritually. And that is really powerful with the work that we do, is that when we change one thing, all your state changes. And that's the impact that we want to have in our practice. We're at the practice, and if there's a cavity, sure, we'll fill it, but we're most importantly going to be looking at why did you get that cavity, right? So that way, once we finish doing the cavity, it's going to last you a lifetime. And that's really our focus here, is really to look at disease and dysfunction, get rid of it, and then prevent it from coming back. And while we're doing it, let's do it very thoroughly. Let's do it very scientifically. Let's do it with data-driven results so we have that confidence in health, that we are doing everything right. And that's really our ultimate goal. My overall health is improving. And that is my wish for you, my friends.